Hello, everyone. Welcome back to the IDRiM podcast. And as now we rocketed live in the IDRiM conference in Samos. And here is the special episodes where we interview all the awards that will be awarded in this conference. And this time we got a pair that is awarded by the IDRiM Implementation Award, which is the awarded for all the efforts that implementing these risk reductions to the community directly. And here we already have the awardees, which is come from Avoidable Deaths Networks. It's this is Nibedita and Hideyuki Shiroshita. Before we proceed with the questions, can you both introduce yourself and what is the Avoidable Deaths Network?
Introduce myself. Okay, so my name is Hideyuki Shiroshita. I'm an associate professor at Kansai University. My area of expertise is disaster education. I and my long-lasting friend jointly established Avoidable Deaths Network in 2019.
Okay. Yeah, hello everyone. My name is Nibedita Ray-Bennett. I'm a professor of risk management based at the University of Leicester. I'm based in two departments in the University of Leicester. One is the School of Business, and I'm also an associate director at the Institute for Environmental Futures. Jointly, Hideyuki and I launched the Avoidable Deaths Network in 2019 at the 4th Summit of GADRI in Kyoto. ADN is a global local network of policymakers, practitioners, students, civilians, dedicated to finding theoretical and practical solutions to reduce avoidable disaster deaths in low and middle income countries. ADN has more than 1,000 members across 95 countries.
Thank you for the introduction. So I want to go back. So I was actually at your launch event back in 2019 in GADRI.
Yes.
So I wanted to get a bit of an idea of where this idea came from. Because I remember the launch event, what was it, about 15, 20 people attended just the day before the GADRI summit. So what was the inspiration and where did it come from?
Well, I think in 2018, I launched my book, which is Avoidable Deaths. And that book talks about why people die in disasters. At the time, the risk and vulnerability approaches that existed was trying to understand why people die at a community level. Whereas my book was trying to understand how organizations like disaster management organizations, emergency services, health and hospital setups can also play an important role in creating a fertile ground for avoidable disaster deaths. So at the time, I just wanted to float around the idea for a network. So the case study for that book was Orissa, which is an eastern state which sits on the coast of the Bay of Bengal. And in 1999, at Category 4, and it was called Super Cyclone, landed in the state of Orissa, and it killed more than 10,000 people. That was in 1999. And in 2014, another Category 4 cyclone landed in the same state, in the state of Orissa, and the casualty was only 86. So I wanted to study what did the government of Orissa do in between 1999 and 2014 to reduce disaster deaths drastically from 10,000 to only 86. So that led to the findings led to my book, Avoidable Deaths. And so I went back to Orissa to launch my book. And there I just, floated the idea of, whether people would be interested in having a network. And, absolutely almost all the audience told me yes. But then to launch something like a network, it's quite daunting, isn't it? You can have great ideas. And IDRiM talks about implementation, because implementation is not just a science, but also a lot of energy, a lot of time, commitment, dedication, working odd hours. I had a young child at the time. Hideyuki was not a father at the time. I did everything early, got married early, had my child early. So it's a lot of commitment to do that, also raising grants constantly to keep this network going. So I was really daunted and very scared. On the other hand, at the time, Hideyuki and I had an ongoing project, and it was funded by Kansai University. We wanted to understand how sustainable development and disaster risk reduction can be integrated into the curriculum in higher education sectors in Japan and in the UK. And Hideyuki, I met Hideyuki in 2007 at Northumbria University, and we just, had a massive, we felt that we could do things together, and we continued working, and we had quite a few projects. So all of those things came into place, and I thought there is an appetite for networking, and we love working together, but I was getting fed up of working from one project to another. And projects have, it's time bound. Sometimes you get the grants for 6 months, 1 year, 2 years. Once that's gone, then you're again looking for another grant. So I really got fed up, and Hideyuki was also getting fed up. So project was ongoing, and we had to go to Japan to present the findings of that project, UK-Japan project on Sustainable Development Goals and DRR. And we were having dinner after our presentation, and my PhD student at the time was Denise Corsell. She was there, and I said, look, I've got this data, I've got an appetite from this audience who attended the book launch event in Orissa, and there is opportunity to launch a network, but I am quite done. I can't do it by myself. It's not possible. And I said, propose this idea to Hideyuki. Hideyuki, would you like to join?
Yeah.
Isn't it?
Yeah. And then as Nibedita said, so we met, know somebody in 2007.
Yeah.
So I know, so how Nibedita works, and then she's a very hard worker. So I'm very happy to work with her. And then because there was a gap between we met and then we started our joint venture, but luckily, as Nibedita mentioned, so we got the fund from Kansai. I think this was the start, to work together.
Yeah.
And then I simply feel interesting. The idea of avoidable deaths is quite interesting. So that is why I agree with start to this joint adventure.
Yes. And that's how we joined. And I think it's interesting that, Ashley, you mentioned you were sitting and you wore our ADN t-shirt. I think that day we launched ADN, and Hideyuki became another co-founding president. And whole day, he told himself, I'm the ADN president. I'm the ADN president, to internalize that idea, So implementation science is not just straightforward standard research. It's something that has to go inside you, believe in it, and deliver it. Yeah.
Very small seed, right? It was just 3 of us. Yeah.
Just three of us. And now, we have 1,000+ members. Our operation team is 20+, with members from different parts of the world. We work virtually. We try to cut down the distance of working in a remote context. And during the time of COVID-19, when everything was locked, ADN was going into everybody's houses, boardrooms, kitchen, bathroom, because we had really interesting strategies to raise the visibility of ADN. At the end of the day, we are responders in some way, isn't it? So COVID-19 was an opportunity for us to show what we can do by sitting at home and bringing different people and different pool of expertise virtually and deliver some of the responses that were required at that point in time, which was not possible in person or physically.
Yeah, it was interesting to hear the origin story and how it's become big. And you mentioned it started with 3. Now, made me wonder, what is the early challenges you face after launching this back in 2019? Is there any particular development that makes you perhaps, this is not working, or there is something that we still needs to get it? What's that?
Yes, I will share my thoughts. Hideyuki has his, because Hideyuki looks after some other aspects of ADN, because ADN, it's a arena of multidisciplinary and transdisciplinary experts and practitioners to come together. It will always bring challenges. So I think to begin with, you see, it is a network. we were just traditional academics. Hideyuki is trained from Kyoto University. I'm from Warwick University. We came from a traditional universities, not from universities where there is a component of practice. This is why I left Warwick University and moved to Northumbria University to get some hands-on practice experience for disaster risk reduction. So imagine from there to transition, shift to an implementation, so which is impactful academic. So it's been a journey that I have cultivated over a period of time. So it didn't come just like that, because I wanted to be an impactful academic by leading the network. So networking is something that we never did. So to really understand and come up with innovative solutions. So another thing we thought that ADN should not be something for publications. So this is why many academics join, hoping that the first thing they will do is publish. That's what academics do. So publication is the last thing for us. Yeah? And publication not in peer review. Of course, we will have to publish in peer reviewed journals, but we wanted to publish something that are for risk community, for general population. So which would mean coming up with non-traditional types of publications, like behavior change communication materials, information education communication materials, press releases, issue briefs, policy briefs, reports, and street arts, creative arts, various kind of methodologies that we explored. Now, those things did not come easily. So the challenges we experienced, if we are a network, what kind of networking model that we can come up with? So that means we have to come out of our traditional disciplines. That's number one. Number two was also in terms of understanding what this network would do, because the domain is always populated, isn't it, with different types of ideas. So I think the way we carved our niche, because it was so easy, we saw many of the members were not able to understand what avoidable deaths do. And it's very interesting. I'll give you one example. I've spoken with really important UN people, and there's Nibedita. I really like the idea, but I do not see any connections with what I do. And I said, what do you do? He said, we promote risk reduction, preparedness amongst children. And I said, but what is the purpose of that? This is the problem with the DRR. Why are you doing this? For example, let's say preparedness, education, capacity building, risk awareness, emergency response. So what is the objective of DRR? The objective is the only objective that we have is to save lives. So bringing saving lives at the heart of disaster risk management, all planning will change the entire perspective. So that's what ADN tried to do, bring all those, cut out all excess fats and just focus on saving people's lives. So that's one thing. And it took us quite a lot of thinking to do that, which meant we had to move out from DRR and borrow ideas from public health and epidemiology, which also meant I educate myself. So I'm also a student at the London School of Hygiene and Tropical Medicine. I'm learning and studying public health. So that's another thing, which meant we had to equip ourselves theoretically. And finally, resource constraint is a major problem. You have to keep the network going, motivated. And we have a strategy called burn bright strategy, not burn out. We work so hard. Whereas when you have a network, reducing avoidable disaster deaths, promoting risk governance, finding out why people die, these are not something you can solve overnight. This might take my entire life and beyond. So how do we keep that momentum going? So for that, keeping motivation, coming up with important strategies that we were not aware of, we didn't know, so we had to learn. So we had to borrow ideas from management theories and organizational practices. And I think finance was a major issue. How do you get funding to keep people going? We are constantly working. And also we have lots of volunteers, but you really can't push the volunteers because they're working full time and they're dedicating their time and energy to ADN's work. So respecting that and finding way to work around. It is a limitation to work with volunteers, but at the same time, it's also an opportunity. So I think these are some things that I would say we experienced in terms of theoretical approach, practical approach, coming up with new networking model, organization for the volunteers, and resource and time management. But is there anything else that you would like to add?
Yes, yes, I think, the, how to say, expanding network is like, for me, because I'm a father, so like, a growing child, and then, yeah, we have very clear, the purpose and the philosophy, as I mentioned. And then I think, the growing child is also very clear, the goal purpose, that is, the health and then happiness for my, children. So, but the way of, growing children is very diverse. So, yeah, so I think, yeah, this is, I think, the difficult point there. What kind of, the way to expand the network. So this is some difficult point, but yeah.
What I'm getting from your ADN network is it's very much about getting out, communicating in new methods.
Yes.
And I'm just wondering whether in DRR that we need to move with the times more. So the 21st century, like we're doing today, podcast, which will reach non-experts as well as experts. And my question is, do you think that we need to do more of this rather than just keep publishing papers just because it suits institutional metrics?
Yes. In my opinion, yes, definitely. Podcast is one complementary tool. You see, you're right. You are reaching out quite a lot of non-technical stakeholders for the DRR community. But to reach the high-risk population, you have to go beyond the podcast. So our local level action network, which we were able to present it yesterday, Hideyuki and I, through a model called case station model. These people carry the burden of disaster deaths. Yeah? They're not digital savvy. They do not have access to podcast. They speak different language, and disaster deaths happen at a local level. So how do we reach this population? So it will be great, IDRiM, young scientists like yourselves, to explore what are the other ways we could reach those populations so that we can promote risk reduction behaviors. Because you see, in 21st century, the way the political landscape is at this point in time, the budget for DRR is shrinking. The budget for health, when we talk about saving lives, is reducing. Budget for risk response is reducing. Yeah, Sendai framework talks about health system resilience. Where is the fund? Health budgets are reducing, and we work in low and middle income countries where the burden of disaster deaths, is being carried. And we're only talking about direct deaths. That's what UNDRR talks about. Whereas avoidable deaths talks about indirect disaster deaths. Often 3 times more times than the direct deaths. It's only Japan is the only country that records indirect deaths. Yeah. So I would say this high risk populations, we have to reach them somehow. So keep exploring, keep trying in addition to podcast. I'm so sorry, I should have so yes, keep doing that. And I think the publication in peer-reviewed journal is one component that you're taking. But DRR is a domain which has practical implications with high impact, such as saving a life. Even if it is one life, it is easier to save 1,000 lives, but harder to save one life. So if there is any way you could reach out to that high risk, vulnerable population in the communities and the towns and the cities that you are working, that will be great. But explore what are the other avenues that we could do. Is it community radios? Is it community newspapers and things like that? Hideyuki might be able to add here because he experiments with those kind of ideas and tools through his children, and the children are the ambassadors. So Hideyuki, I invite you now. So
okay, thank you very much. Yes, I think, yeah, as for the communication regarding disaster risk reduction or saving people's life, I think, yeah, it's good to use lots of the variety of media, like as Nibedita mentioned. I had a project with school children, and then I think 2 years ago we used the film. So students make some disaster related film for the general public. So this kind of the new idea or new way of communication we should use to deliver the important message of disaster risk reduction to a general public. But in terms of the relation between the implementation and the traditional type of science. I think good implementation is usually or always underpinned by the good theory. So in this light, I think, yeah, still, the both traditional type of science is quite important. And then you also, some translation also needed to deliver the important information from science to general public.
Finally, when you were talking about your case study about the cyclones, for a second, and my institute is going to love this question. I closed my eyes and I was almost hearing Phil O'Keefe. We all, us three, had a close bond with Phil because we've all worked with him at one point. So what I heard was that Phil telling that story about Bangladesh, 1970, 400,000 people were killed. And they did institutional changes. 2010, I think it was, and it was about 4,000 to 10,000. And that's what I remember him teaching us. One of the first things we got taught in our master's program was that exact same type of case study. So my question is, how much do you think the Northumbrians influenced you? Especially my university is going to love this question. Like people like Phil, Jeff O'Brien, Andrew Collins, how much has that influenced you in your research over the years?
That's a very good question. I owe them a lot to, because they are giants, giants in the field. I think Professor Phil O'Keefe was great. He was the first academic who tried to take the naturalness out of natural disasters. That's a very powerful strapline. And I don't know how many times it has been quoted, maybe thousands of times. So his work was very inspirational when I was studying my PhD in sociology, because I don't have a background in disasters, So I did PhD in sociology, where I was looking into the sociology of caste, class, and gender, and especially what happens to caste, class, and gender in multiple disasters. Does it break down? Does it become flexible? And I think Phil O'Keefe's works were very instrumental in informing that element, that take the naturalness out of natural hazard. Once you do that, then you see that disasters are social constructions. So that's one thing. Then later on, I met Professor Andrew Collins. So Professor Andrew Collins was my first line manager, my first mentor, who gave me my first academic job as a postdoc of ESRC Research Associate. And that job took me to Bangladesh. I wanted to go to Bangladesh. It's a hotspot for natural disasters. Now, that PhD postdoc research was on health security. We wanted to understand what happens to the link between health security and resilience, which means if someone is healthy, are they able to withstand the disaster compared to someone who is not healthy? That took me to the domain of public health. Now, I don't have a background in public health. As I said, I came from the domain of sociology. So I really got interested in public health to an extent that I love public health. And I have emailed Professor Andrew Collins a couple of times about that, just to thank him to introduce me to that domain of health, because I don't come with a background. And I said, as I always wanted to be an impactful academic, public health gave me that edge. It was through public health I was able to achieve what I am achieving at this point in time. And as you say, avoidable deaths basically is a public health concept. What we are trying to do, bring that concept of avoidable deaths, transport it from public health to the domain of disaster risk reduction. And my latest book, which is Avoiding Disaster Deaths, gives that theoretical support, how we can transfer avoidable deaths from public health to DRR by calling it avoidable disaster deaths. And so we have the concept of disaster deaths in the domain of DRR, but not avoidable disaster deaths. Whereas we have the concept of avoidable deaths in public health and epidemiology, but they do not have the concept of avoidable disaster deaths. So my book brings those two different disparate disciplines under this, in the middle ground, which is the avoidable disaster deaths, because people are dying in disasters, and death falls under the ambit of epidemiology and public health, whereas disaster deaths fall under the ambit of disaster risk reduction. So my book tries to bridge that gap between these two disciplines through the concept of avoidable disaster deaths. Now, I owe a lot to Professor Andrew Collins. If it was not Professor Collins, I would have not been in this field. He gave me the first job. He had tremendous confidence in me, despite that I had no background in public health. And here I am, I developed the intervention model, which is called R8CC, which was run in the government of Bangladesh's several health facilities. And that intervention model called R8CC, it allows the health system to function even when there is flood. That R8CC intervention led to the reproductive health kits, first of its kind, based on the principle of localization. It's based on 10 years of research. And currently those reproductive health kits, which are called facility kit and mobile kit, they're designed to reduce maternal mortality during disasters. And currently with the funding from ESRC and AHRC, I'm commercializing it. In about a year or half time, in about, I would say 12 to 15 months, those kits will be in the global market. And those kits are designed to save lives in low and middle income countries set up. So yes, I would say, Phil O'Keefe was great in those formative years to clear my thinking. But later on, I would say Professor Andrew Collins gave me this opportunity to become an impactful academic. And I grabbed that opportunity and I constantly email him for ideas and thoughts. Yes, so I hope I managed to answer your questions.
Thanks.
To make it fair, so Professor Shiroshita, can you also explain perhaps the role models that make you come to this field and further expand it to your research right now?
Right, role model.
Yes.
Okay, role model. It's definitely the Professor Norio Okada. Yeah. So yes. So yeah, when I look back, what we have done the last maybe 20 years. Yeah, always. Yeah, he was with us. Yeah, with me. Yeah, and then actually, for example, when I was a PhD student at Kyoto University, at the time I have, I had another professor as a supervisor, but Professor Okada is also kind of, the co-supervisor. And then at that time, I felt, my outlook to the world was very narrow. So I consulted with Professor Norio Okada. And then at that time, his suggestion is I should go to somewhere to expand my, outlook. And then he recommended me to go to Northumbria University. Actually, spending 1 year at Northumbria University, just the development center under the supervision of Professor Andrew Collins was my life-changing experience. Definitely. Yeah, I could meet with.
Yes.
Yes.
Absolutely.
Yeah.
Without Professor Andrew Collins,
Yeah.
without Professor Norio Okada, there would be no ADN. We would have not met Hideyuki.
Yeah, exactly. And then at that time, I had a project about disaster education in the UK, and lots of the professors gave me a lot of chance to meet the practitioners, not only practitioners, but mainly practitioners, because this is quite important. Also, the school teachers in the UK. So they gave me lots of chance to learn the things. And then after that, yeah, we successfully got a grant, ESRC, as seminary and disaster education in Japan and the UK. So I think, this is really, nice, super experience. Yeah.
Yeah. And I think Professor Norio Okada keeps inspiring us. Our case station model is based on Professor Norio Okada's Casablanca. And I mean, we are truly honored, aren't we, to receive the Professor Norio Okada's Distinguished Implementation Science Award 2025. I mean, it's truly amazing. It's, I would say, dream come true. It's a bit early. So we are truly honored. Yeah, they are our role models, absolutely.
Yes.
Thank you once again for coming to this interview, and congratulations for your achievement to actually expand the Avoidable Deaths Networks to receive the Implementation Science Awards. And of course, we hope that you're still expanding it and actually reduce the death from the disasters. in the future as we heading to more uncertainty and more devastating looks like in the future. So that's it, everyone, for the interview with the winners of the Indonesian Science Awards. And as we mentioned, we will also there are some interviews after this, so stay tuned. Bye.
Thank you very much. Thank you. Bye.